Hi, this is Dr. Praveen Saxena, and I'm a founder of Dr. Saxena Integrative Medicine, which we established in the year 2017. And this particular thing is what I can tell you. Integrative medicine, in a nutshell, is trying to take the best of allopathy as well as trying to use something from the naturopathy and other traditional therapies. So it's more of a cherry picking, trying to take the best of things. I have my people around. I take some our consultant Ayurvedic doctor. We have a consultant homeopathic doctor, and we have somebody from naturopathy side. And I basically see that what is best for the patient. So we are not doing mixopathy. Here we are trying to see that the best of the possible hands are there with us. So I'll just have to tell you about something what we are working on that. This is a daycare center. We have a something like a small hospital, and where we are working on taking the patient 2 3 hours. He will be sent back to the home. So there is no because hospital setup is a different one. We believe that if I can do this particular thing for some 2 hours patient, I work on that. Things are getting much better for the patient. They come for all chronic diseases. It can be something like a diabetes. It can be something like cancer and heart disease. So many things. The basic thing is we don't deal with acute cases. If somebody is having MI, heart attack, he has to go to the proper center. Whereas after stenting, after bypass, still the patient is having breathlessness, she is having a angina. So that are the cases we are catering here. And again, trying to work on some modalities. I'll be showing you the modalities. Apache. Coming back to the therapies, what we are doing, one of them is called EECP, which is something like enhanced external counterpulsation, where we are trying to work with the, this is more of a flow dynamics we are changing. And by this, people having low ejection fraction, the people who is having some breathlessness, or people who is not getting better after a stent or a bypass also, just by doing this, it's a 35-day process, and we hope this kind of thing should come in India. This is one of the imported ones from the US. This is not my make. Thank you. So I was talking about how we are using this things. This is something like out of box things where we are doing some kind of detox. This is also one of the methodologies by which we work on that, which is called ionic food detox. And on some areas with ultraviolet UVB, we work with some kind of, even we use the peristaltic pump for that ozone and all that. Apart from that, we use something called this particular stuff. It's a laser used in medicine in a big ways. We are trying to work on this particular way. By in we using laser, we are there is a the diabetic foot ulcer, or there is something like non-healing ulcers. They do so well phenomenally with this. We are using something called ozone therapy, which is again one of the alternate medicine, and this is quite simple ways. Apart from that, we are using something called hydrogen therapy. This makes a difference. Okay. So we are using something like pulse electromagnetic field, and this pulse electromagnetic field is a very we try to induce pulses, and this happens. So why what I is making me combine all this process is maybe the chronicity of the disease, where you have something on the some process millivoltage and all that, that gets corrected. So this is something called hyperbaric oxygen, and by doing hyperbaric oxygen, which was we have some indications for hyperbaric oxygen. We started working on autism, and